To diagnose female sexual dysfunction, your doctor may first discuss your sexual and medical history. You might be uneasy talking with your doctor about such personal matters, but your sexuality is a key part of your well being. The more upfront you can be about your sexual history and current problems, the better your chances of finding an effective way to treat them. The second, perform a pelvic exam. During the exam, your doctor checks for physical changes that affect your sexual enjoyment, such as thinning of your genital tissues, decreased skin elasticity, and scarring or pain. And the third is other blood tests. Your doctors may recommend blood tests to check for underlying health conditions that might contribute to sexual dysfunction. Your doctor may also refer you to a counselor or therapist specializing in sexual and relationship problems. The treatment. Keep in mind that sexual dysfunction is a problem only if it bothers you. If it doesn't bother you, there is no need for treatment. Because female sexual dysfunction has many possible symptoms and causes, treatment varies. It is important for you to communicate with your concern as well as to understand your body and its normal sexual response. Also, your goals for your sex life are important for choosing a treatment and evaluating whether or not it is working for you. Women with sexual concern most often benefit from a combined treatment approach that addresses medical as well as relationship and emotional issues. Non-medical treatment for female sexual dysfunction. To treat sexual dysfunction, your doctor might recommend that you start with this strategy. First, talk and listen. Open communication with your partner makes a world of difference in your sexual satisfaction. Even if you are not used to talking about your likes and dislikes, learning to do so and providing feedback in non-threatening ways sets the stage for greater intimacy. The second, practice healthy lifestyle habits. Limit alcohol. Drinking too much can blunt your sexual responsiveness. Be physically active. Regular physical activity can increase your stamina and elevate your mood, enhancing romantic feelings. Learn ways to decrease stress so you can focus on and enjoy sexual experiences. The third, seek counseling. Talk with a counselor or therapist who specializes in sexual and relationship problems. Therapy often includes education about how to optimize your body's sexual response, ways to enhance intimacy with your partner, and recommendations for reading materials or couple exercises. Third, use a lubricant. A vaginal lubricant may be helpful during intercourse if you have vaginal dryness or pain during sex. And fourth, try a device. Arousal may be enhanced with stimulation of the clitoris. Use a vibrator or to provide clitoral stimulation. Medical treatment for female sexual dysfunction. Effective treatment for sexual dysfunction often require addressing an underlying medical condition or hormonal change. Your doctor may suggest changing a medication you are taking or prescribing a new one. Possible treatment for female sexual dysfunction may include: first, estrogen therapy. Localized estrogen therapy comes in the form of vaginal ring, cream, or tablets. This therapy benefits sexual function by improving vaginal tone and elasticity, increasing vaginal blood flow, and enhancing lubrication. The risk of hormone therapy may vary depending on your age, your risk of other health issues such as heart and blood vessel disease and cancer, the dose and the type of hormone, and whether estrogen is given alone or with progestin. Talk with your doctor about benefits and risks. In some cases, hormonal therapy might require close monitoring by your doctor. And then, ospemifene or ospena. This medication is a selective estrogen receptor modulator. It is help reduce pain during sex for women with vulvovaginal atrophy. You can also have a therapy with androgen therapy. Androgens include testosterone. The testosterone plays a role in healthy sexual function in women as well as men, although women have much lower level of testosterone. Androgen therapy for sexual dysfunction is controversial. Some studies show a benefit for women who have low testosterone level and develop sexual dysfunction, and other studies show little or no benefit. And then flibanserin, ADI. Originally developed as an antidepressant, flibanserin is approved by the Food and Drug Administration (FDA) as a treatment for low sexual desire in premenopausal women. A daily pill a day must boost sex drive in women who experience low sexual desire and find it distressing. Potentially serious side effects include low blood pressure, sleepiness, nausea, fatigue, dizziness, and fainting, particularly if the drug is mixed with alcohol. Experts recommend that you stop taking the drug if you don't notice an improvement in your sex drive after 8 weeks. And then bremelanotide, Fielisi. Bremelanotide is another FDA-approved treatment for low sexual desire in premenopausal women. This medication is an injection you give yourself just under the skin, in the belly or thigh before anticipated sexual activity. Some women experience nausea, which is more common after the first injection, but tends to improve with the second injection. Other side effects include vomiting, flushing, headache, and skin reaction at the site of injection. Potential treatment that need more research. More research is needed before this agent might be recommended for a treatment of female sexual dysfunction. There are Tibolone. Tibolone is a synthetic steroid drug used in Europe and Australia for treatment of postmenopausal osteoporosis. The second phosphodiesterase inhibitor. This group of medication has proved successful in treating erectile dysfunction in men, but the drugs don't work nearly as well in treating female sexual dysfunction. Studies looking into the effectiveness of these drugs in women show inconsistent results. One drug of sildenafil may prove beneficial for some women who have sexual dysfunction as a result of taking selective serotonin reuptake inhibitors or SSRIs, a class of drug used to treat depression. Don't take sildenafil if you use nitroglycerin for angina, a type of chest pain caused by reduced blood flow to heart. So, issues surrounding female sexual dysfunction are usually complex, so even the best medications are not likely to work if other emotional or social factors remain unresolved. Thank you.